Hello, and welcome to this introductory video on Carex Canada. The objectives of this webinar are twofold: to provide an overview of Carex Canada, who we are, and what we do, and to familiarize you with the Carex Canada website. We will provide an overview of the carcinogen database. We will also introduce the occupational and environmental estimates, methods, and tools, but these are described in more detail in other videos on our website. Finally, we'll describe some of the ways we've built on our estimates of exposure to provide additional evidence about priority exposures and populations. Carex stands for Carcinogen Exposure. Carex Canada was originally funded as a pilot project by WorkSafe BC in 2003, but has been fully funded since 2008 by the Canadian Partnership Against Cancer, which is an independent organization funded by Health Canada to accelerate action on cancer control. We were originally established at the University of British Columbia, but we are now based at Simon Fraser University. Carex Canada builds on a model established by the Finnish Institute of Occupational Health in the early 1990s that was created for the European Union's Europe Against Cancer program. The goal of these original Carex projects was to estimate exposures in workplaces. Unlike the EU Carex projects, Carex Canada is unique because it also includes an environmental component. Ultimately, we hope to inspire action towards reducing Canadians' exposures to carcinogens. Scientific rigor and knowledge mobilization are at the core of this mission. We work to achieve our mission by offering an accessible repository of information about Canadians' exposures to carcinogens and providing expertise to help set evidence-based priorities for research, policy, and practice. We also offer up-to-date information about how exposures are changing over time and with changing environments, and we support efforts to reduce inequities in exposure across jurisdictions and populations. Carex Canada is a multidisciplinary team of researchers based at the Faculty of Health Sciences at Simon Fraser University in Vancouver and Alberta Health Services in Calgary. We have expertise in a variety of fields, including epidemiology, occupational hygiene, risk assessment, geographic information systems, and knowledge translation and exchange. We offer a number of resources and tools on our website platform. Substance profiles with information on over 75 known or suspected carcinogens describe the carcinogens' health impacts, main uses, and exposures in the Canadian population. We have greater than 30 environmental exposure estimates, which look at lifetime excess cancer risk from exposures in community environments. We also have greater than 40 occupational exposure estimates, which describe the number of workers exposed by occupation and industry, and the level of exposure. We offer an interactive tool that can be used to explore the occupational estimate data in greater detail called eWork. Finally, we offer a number of resources, including our package summaries, which package information in specific ways that may be useful to the reader. For example, Carex Canada data have been synthesized by occupation, industry, province, route of exposure, population, cancer site, and exposure source. And finally, our special topics pages explore priority occupational and environmental exposures and exposed populations in more detail. Cancer is the leading cause of death in Canada. The Canadian Cancer Society estimates that half of all cancers can be prevented through healthy living and policies that protect the health of Canadians. Carex knowledge and expertise has been used to support cancer prevention in a number of ways. One, These estimates can be used to raise awareness of carcinogens and the importance of reducing exposure. Another is bringing together partners and those working in the field to collaborate on prevention efforts through networks. For example, Carex has played a networking role at national and provincial levels around several priority exposures, including radon gas in homes and solar UV for outdoor workers. With so many potential exposures to consider for control activities, deciding which ones to focus on is a challenge for many organizations. Carex exposure estimates and expertise help to identify which populations are at high risk of exposure. They also help to identify what the priority exposures are for a given jurisdiction, industry, or workplace. Many organizations have worked with us to support their priority setting. For example, WorkSafe BC has used Carex resources to take a risk-based approach to preventing occupational disease. Between 2012 and 2017, Carex Canada tracked a total of 54 impacts, which we define as changes to programs, policy, and practice, and include agenda and priority setting and organizational or governmental shifts in operations or decision-making. Many of these impacts are described in the publication referenced at the bottom of this slide. Finally, Carex estimates and reports have informed research opportunities. They've been directly applied in projects such as the Burden of Occupational Cancer, led by the Occupational Cancer Research Centre, which has in turn informed several policy impacts. Carex estimates of exposure are calculated based on existing data sources, including provincial and federal data and reports, published data, scientific literature, workplace exposure measurements, and other gray literature. For the various reports we've developed on special topics, key informant interviews have also been a source of data. Carex research methods for estimates of exposure include literature reviews and exposure assessment. The resources on priority exposures and populations apply both quantitative and qualitative research methods. Carex methods and research are reviewed through advisory committees that include experts within the areas of research. For example, to develop our pesticide exposure estimates, an advisory committee comprised of experts in geographic information systems, pesticides research and regulation, and exposure assessment was assembled. Methods are also peer-reviewed through the scientific publication process. Transparency is a key aspect of our mandate, and the methods we use to create the estimates are meticulously recorded. Knowledge mobilization is at the core of what we do. Knowledge users are crucial to that work. The knowledge users we work with are responsible for protecting Canadians from exposures to carcinogens in workplace and community environments. They work at provincial and federal government agencies, cancer agencies, health authorities, workers' compensation boards, NGOs, and Indigenous organizations. Mobilization is an engaged process of applying research and expertise that occurs through working groups, networks, and partnerships. Some of our partners include the Occupational Cancer Research Centre, BC Teachers Federation, Canadian Environmental Law Association, Canadian Cancer Society, Ontario Health, and in particular, the Indigenous Cancer Care Unit, First Nations Health Authority, and WorkSafe BC. We focus on more than 75 substances, and these are selected based on evaluations made by the International Agency for Research on Cancer, which is also referred to as IARC. IARC has classified over 900 agents into different groups based on their carcinogenicity to humans. We focus on IARC Group 1, or known carcinogens, such as asbestos or crystalline silica. IARC Group 2A, or probable carcinogens, such as night shiftwork and acrylamide. And IARC Group 2B, or possible carcinogens, such as phthalates and some pesticides. Carcinogens were prioritized for occupational and/or environmental exposure estimation based on a number of factors. First, we looked at the likelihood that the substance is present and/or used in Canadian workplaces and communities. Substances were excluded if they were unlikely to be encountered in Canada at the time of prioritization, for example, long-banned chemicals. Note that we also excluded biological carcinogens and personal choice exposures, such as chewing tobacco. Second, we looked at the toxicity of the substance. In particular, we looked at the strength of evidence for carcinogenicity, as well as for other health effects. We primarily referred to the IARC evaluations for this information. Third, we examined the feasibility to produce a profile and/or estimate. In other words, was there existing data from which we could draw? And finally, we looked to see if there was special interest in the substance from the public or scientific community, based on evaluations of Carex materials and public and scientific inquiries received by Carex Canada. Now, we'll move on to a live demonstration of our webpage. On our landing page, we highlight the latest Carex news and resources, as well as featured pages that may be of interest. Further down the page, we highlight 8 of our priority carcinogens, as well as our tools and package summaries. Note that the tools and package summaries may also be accessed via the Resources tab on the top of the screen. Our contact information, FAQs, terms of use, glossary, and the option to subscribe to our newsletters are available at the bottom of each page. We offer 2 newsletters, Carcinogen in the News, which is a monthly compilation of media articles, government reports, and academic literature related to the carcinogens that we've classified as important for surveillance in Canada. We also have the e-bulletin, which is a biannual summary of information on recent publications, upcoming webinars or events, and updates related to Carex research and resources. Our main resources are our carcinogen profiles and estimates, which you can access under Carcinogen Profiles. Here, you can access our full list of profiles on more than 75 known or suspected carcinogens, which detail information on carcinogenic evidence, main uses for the substance, regulatory information, and information about occupational and environmental exposure where available. This list can be filtered by type of carcinogen by clicking on any of these tabs. On this page, you can also find information on how carcinogens were classified and prioritized. You can also learn more about the general approach used to estimate the environmental and occupational exposure estimates. To learn more about the Canadian Workplace Exposure Database, which is a national exposure database that was created as a part of Carex Canada and applied in developing the estimates of occupational exposure, click here. To view the carcinogen profile, click on the image of the substance you want to read more about. We are now on the substance profile page. If you'd like to skip ahead to the environmental or occupational exposure estimates or additional resources on the substance, you can use the navigation pane at the top of the page. If an occupational or environmental estimate is not available for the substance you are reviewing, the tabs will not be present. On each substance profile, you can find the IARC classification, the CAS number, which is a unique identifier used for chemical substances, and a complete list of IARC monographs in which the substance was evaluated. You can use the table of contents to navigate to any section on the page. The sections will vary by substance, but may include the quick summary, which provides a brief summary of the profile information, general information, which describes what the substance is, its IARC classification, and associated health effects, regulations and guidelines section, which includes mandatory and recommended limits that the substance should not exceed in different environments, such as the workplace, in drinking water, and others. The profile page also includes a section on main uses, Canadian production and trade, and an overview of the environmental and occupational exposures, which describe how individuals are exposed in the work and community, and, if available, summarize Carex's occupational and environmental exposure estimates. You can also access the occupational and/or environmental estimates here by clicking on the Occupational Estimate or Environmental Estimate buttons. The sources are available at the bottom of the page. Click on the gray box to expand. Next, we will explore the Environmental Exposures tab for benzene. The first section of the Environmental Estimate page is the Overview, which presents similar information as the Environmental Exposure Overview section on the profile page. Where available, we offer interactive maps of predicted levels or potential exposure for each substance. The environmental estimates are presented as potential lifetime excess cancer risks, which are an indicator of Canadians' exposures to known or suspected carcinogens in the environment. These are located under Cancer Risk Estimates. Here, you can also compare our risk estimates by route of exposure, such as indoor air or drinking water. The methods, data, and sources are available at the bottom of the page. To learn more about our environmental exposure estimates, please refer to our Environmental Exposure Estimates video. Next, we'll explore the Occupational Exposure Estimates page for benzene. The first section of the Occupational Estimate page is the Overview, which presents similar information as the Occupational Exposure Overview section on the profile page. The next section presents the prevalence of exposure, which is the number of workers exposed to the substance overall, by industry, and by province. We also offer estimates by the level of exposure overall, and by occupation or industry. The methods, data, and sources are available at the bottom of the page. To learn more about our occupational exposure estimates, please refer to our Occupational Exposure Estimates video. Finally, if you'd like to view other Carex resources and publications related to this carcinogen, we have compiled these under the Resources tab. We also offer a series of special topics pages that highlight some of our priority areas of research and collaboration. These include overviews of workplace exposures to anti-neoplastic agents and solar radiation, emerging issues that we're monitoring, our work with First Nations organizations, and our resources on radon in buildings and pesticides. Under the Resources tab, you can find general Carex communications, including announcements, featured carcinogen in the news stories from our newsletter, as well as our biannual e-bulletin. Here, you can also find our package summaries, which assemble various Carex Canada data, tools, and resources by occupation, industry, and more. Carex authored scientific publications and reports, videos, including recordings of past webinars and other Carex Canada overview videos, and a compilation of exposure reduction resources. You can also access our eWork tool, which can be used to explore the occupational exposure estimates in more detail. Finally, you can explore the About Us page to learn more about Carex's mission, vision, and guiding principles, how we are funded, our team biographies, our advisors, and more. That brings us to the end of the presentation. Thanks for listening, and please reach out to us if you have any questions.